We're now live.
Good afternoon. Welcome to the BCP Council Health and Wellbeing Board. My name is Councillor David Brown. I'm the chair of the Health and Wellbeing Board. We'll just go straight into our agenda, but I'll ask our Democratic Services Officer just to do the housekeeping, if you could do, please.
Thank you, Chair. Please note that this meeting of the Health and Wellbeing Board is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. This meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair. For those in the room, please note that if a fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point along Bradley Road under the flyover. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you.
Thanks for that. So agenda item 1, apologies. If you could just confirm apologies for this meeting.
Yes, Chair. Apologies have been received from Councillor Richard Burton, Betty Butley, Kathy Hadley, Matthew Bryant, Heather Dixie, Karen Loftus and Mark House. And
substitute.
Yeah, substitutes. So Rachel Trickey is substituting for Karen Loftus and Stuart Gillian is subbing for Mark House and Rachel Gravitt is subbing for Kathy Hadley. Thank you.
Right, thank you. I understand we are poor rate, so we've got enough people in the room and a few colleagues online as well. So agenda item 3, just the confirmation of the minutes, just of the meeting that we held on the 18th of December, just before Christmas, that members will recall. Minutes have been distributed around to committee members. Any comments or amendments, or members happy to sound?
Yeah, thanks, Councillor Brown. Not to comment on the minutes, but there was one action in there relating to the health checks paper, which I said that we'd take away and resolve that query, because I think there's a mismatch between some of the data that's reported in the text and the data that's reported in the tables. We think it's that there's a lag in some of the information that's connected with the submission of payment claims. So one of them would have been taken from a more up-to-date source, if that makes sense.
Right. Okay. Thanks for that sort of matter arising from the minutes. Any other comments, or are members happy to approve those minutes for me to sign? Oh, Siobhan.
Hi, David. I'm not noted as sending apologies, and I suppose I just wanted to check. I think formally I am a member of the Health and Wellbeing Board, but I suppose as Chief Executive UHD, should I be there?
That's a good point. Yeah, we'll note those on the apologies then.
Thank you.
Thank you. Okay, no other points on the minutes, then we'll approve those and I'll sign a copy for the records. Thank you. And going to agenda item 4, just declarations of interests. Does any members have any declarations to report, any pecuniary interests or other personal interests they wanted to note? No, doesn't look like we've got any. If anything comes up during the discussion, then please feel free to raise your hand and we'll note that at the time. Agenda item 5, public issues. I understand none received for this meeting.
No, Chair.
Okay, so we can go straight on to, just got 2 main agenda items today. So agenda item 6, the joint strategic needs assessment, the narrative update. So I'll just invite Sam, who's our Director of Public Health, and I think Natasha probably as well.
Yeah, thanks, Chairman. I'd like to invite Natasha Morris to give the presentation today.
Thank you.
Thank you, Chair. Thank you, Sam. So the paper that's been shared with the board today is to show the latest annual update of the Joint Strategic Needs Assessment narrative for Bournemouth, Christchurch and Poole. Joint Strategic Needs Assessment looks at the current and future health and wellbeing needs of our local population. It provides an evidence base that pulls from both qualitative and quantitative data, and the aim being to support planning and commissioning of services, to inform strategies and also prepare bids and business cases so people can pull from that evidence bank. As part of our local processes, we produce an annual narrative, and that highlights some of the key data trends and qualitative insights that are relevant to our population. The latest annual narrative collates insights from a number of sources, something we've been working to develop over time to build that picture of local needs. So the latest update pulls from engagement on key health and wellbeing issues with organisations across the ICS. It also pulls on national health and wellbeing data that's published by organisations such as the Office for National Statistics. It pulls on local insight reports developed by various intelligence teams across our ICS system, and including reports produced by Healthwatch Dorset. And it also is pulling from qualitative insights, so insights gathered from local resident surveys and also the Integrated Care Partnership 100 Conversations project that was carried out last year. The annual narrative is structured into 3 themes sections, looking at needs related to thriving communities, needs relating to healthy lives, and needs relating to health and care, so how different parts of the system works together. And the ask of the board today is to note the updated JSNA document and approve its publication on the JSNA website. I wasn't planning to go through all of the details. It's quite a lengthy report, but happy to answer any questions or take any comments as well.
Okay, thanks very much, Natasha. Obviously members had this sent out a week or so ago to have a look through. Any comments or questions for either Natasha or Sam on the? Looks like you might get off easy. Any queries? It's a narrative update. My only question was to what extent has it sort of changed from previous versions, really, and any particular highlights? And I know it notes that it's partly obviously in response to discussions with the ICS and various parts of the integrated care system, just to sort of key changes from the sort of last version. Really.
Yes, I would say that a lot of the key health and wellbeing indicators from national data tend to remain similar. They don't tend to change quite quickly. What's particularly relevant to this version of this year's update is the insight coming from local insights in the 100 Conversations project. So the section towards the end around health and care, I think there's particularly some very useful insights coming out of that, which adds to those national data sources and gives us a bit more flavour of what life is like and people's experiences of services. So there's a number of points within that section that are new to this year.
Any other comments or questions? Yeah.
Thanks. I guess to add to that, it'd be interesting to know if you think there are any gaps, if there's anything that you could do with local insights on that you didn't have to support the document.
Thank you. That's a really good question. I think there's probably always more that we could know, but certainly I think some of the points that I'm picking up from local and national data is around understanding mental health and wellbeing, especially with cost of living crisis, in terms of that community low level mental health. And secondly, I picked up quite a bit in the data about people who are living with multiple long-term conditions, something that's picked up in the NHS major conditions strategy, but I think is worth exploration a bit further over the next year as part of the JSNA.
Thanks for that, Sam.
Yeah, thank you, Chair. I was just following on from Louise's question, which is an excellent prompt, really. Just to remind the board that the board's responsible for maintaining this joint strategic needs assessment, but the real question is, how are we going to use it? to inform some of the changes or the planned changes in different models of care, looking at the sort of opportunities coming forward in the system. So there's something here for NHS partners to think about when you're looking at things like the statutory responsibility to tackle inequalities. That hasn't changed in BCP Council, where we generally perform similar to England on many of those kind of standard measures. But when you look in more detail across smaller areas, you can see some quite big variations. One of the charts in here that's always quite striking is the variation in standardised admissions for coronary heart disease, which can vary significantly across small area bases. I think also there's a slide in here that Nat's included on the future focus on health and care, bearing in mind some of the challenges around ageing. And it's not just about an ageing population, but that point about how you consider people's mental well-being needs as well as their physical needs is something that in the past we haven't always got right. So we're very, very good at physical triage processes. When it's more complicated, we need to be thinking differently about how to provide time and space and perhaps different training to allow some of those conversations to develop. Because we do know there's a big overlay between people who are traditionally on disease registers living with long-term conditions and the proportion of those people who will say that they also have significant depression, anxiety, as well as a whole load of increasing challenges because of cost of living and some of those other big issues in society that are coming forward. And that's what came through from some of the work that we did, particularly the engagement work, talking to people in communities. So I think one of the conversations I hope the board would have is not just we've got a JSNA and we've published it, it's so what? How do we start to find the spaces where we can really influence commissioning, changes to services, and have some of these key points at the top of people's minds when we're going in looking for opportunities to do things better. So really important document for me.
Thanks for those comments, Sam. Yes.
May I ask about I was interested in the local access to services, the transport links, and what level of granularity we have that data in, given the future plan changes within the areas for the hospitals, for example, but also, I mean, it's limited access to transport, travel links. How much data have we got behind that, and is that a key part of what we can do to change things?
So I think there's certainly in our planning and transportation departments have data on links to public transport and roads. It's something that we look at as part of like the pharmaceutical needs assessment. So there's kind of the logistical data out there in several different places. I think coming back to Sam's point is how can we use it best?
Yeah, thanks for that. I think it's a good point, isn't it? Because we get a lot of comments from people about health provision, but also about how easy it is for them to access when they need to. So,
yeah, thank you. So it's a really great report. Actually, I enjoyed through various other reasons. I've been looking at JSNAs in other parts of the country, not for my own benefit, but for my son who's applying for university places, and they're rubbish. I shouldn't say that. No, but no, they're not as accessible. I'm exaggerating for impact, but this is really accessible, and I've gone back and forth over it a few times just to sort of make sure I'm grasping it all, because there's an awful lot of information there and it's super helpful. And I was just thinking that kind of if you stand back from it, so right in front of me now, I've got open healthy lives, major health conditions, because that's kind of being through an NHS lens, that's where my brain goes. But I'm actually thinking about it that some of these things it cannot be solved at the health end, and we need to sort of go behind it. And so I guess my sort of interest and curiosity is whether from all of this kind of wealth of information and this take on it, the way it's presented, what are the things that come to the top? Is if we put some effort and energy in these handful of things, doesn't matter which end of the sort of spectrum it is, but our best thoughts, recommendations would be, out of all this information, this is the stuff that floats up and says, put your effort there and you'll get a biggest impact. I don't know if that's been done or that's been thought about, or is that something we could do? But that would be extremely helpful to guide us into the right place as a health and wellbeing board. I mean, rather than me and people like me looking at the world and cherry picking the bits that sort of, oh, that talks to my world. But actually, I need to hold the breadth. Don't
Yeah, thanks, Ed.
So rather than give a comprehensive answer now, I think that's a good discipline to be using when we're having some of these conversations. And I'm just looking at the Healthy Life slide. Immediately, one of the things that jumps out and has jumped out for a long time is why our rate of hip fractures in BCP Council is higher. That suggests to me that although we've got good hospital services and we're good at getting people in for surgery when people fracture their neck and femur, how much thought are we giving to possibility of intervening earlier? You know, is it because people are not fit enough? Is it because there's something about bone density? We don't really know. So you have to ask slightly different questions, and that brings in your point, which is it's not just about the health service and large pathways. There's lots and lots of stuff that can be done in communities and neighbourhoods to keep people, you know, fit and well, and hopefully, you know, mobile for longer. So how good are we as a system at detecting people at risk of starting to fall? That's one of the questions that I think would be good for us to ask. And there's many more. So you have to go through that discipline of saying, just because we can measure the end result, it might not tell us what's happening along the pathway to that end result. So definitely be really helpful to have some of those challenges coming forward when we think about some of those opportunities to improve.
Thanks for that, Sam. Yeah.
Is that me?
So, sorry, just got somebody in the room.
Sorry. I was just saying, in response to the gap of information that you stated around the mental health and that impact, I wonder whether that's part really working alongside that mental health transformation of that system piece of work that has been looking really clearly at let's work at that preventative early intervention stage. And I work for CAN, so therefore I've been involved in those conversations around that universal offer, so that community offer, which encompasses the hubs. There's 2 hub pilot sites, and they are the wellbeing coordinator roles that will grow over the next year. And I think that will be really useful because the pool hub opened to open access on Monday last week, and within the first 2 hours there was 8 people coming through the door, and the prevalence of need was coming through very loud and clear. Isolation as well. There's autism. There was several people that came through with autism, and that was just in the 1.5 hours that I was there at that time. So we will start to learn a lot about people that are coming into that space, and I think that is going to be hugely helpful. And in addition to that, as part of that mental health transformation, there has been a fund put forward from the NHS Dorset from a piece of funding that we've been holding to support those launching community organisations to deliver wellbeing and mental health at the point at which people, again, at that preventative early stage, to support people around things that might be causing them that lower level mental health need without needing that primary care over again. So that will also give us some really good information as we collate that data. So I just wanted to cite you on those 2 things that we really do need to make sure that we're connecting.
Thanks for that, Rachel. Thank you. Any other comments, or is it Siobhan you wanted to come in?
I'm not sure I know everyone, but I'm Siobhan, Chief Exec at University Hospitals Dorset. Having read many JSNAs, what I really like about this is it's quite succinct, but full of some really, really good information and statistics and knowledge of BCP. I think it's really opportune because we've got the ICS, the Integrated Care Strategy, we've got this JSNA, and we're all going through quite a lot of change. So actually taking elements of this, and for me personally, building it into the clinical conversations we're having with clinicians about their strategy over the next 3 to 5 years is really valuable. But also with an emphasis on prevention, the work on fractures, you're right, Sam, really jumps out at you, but also the smoking. And really, from our perspective, driving a sort of smoke-free agenda is going to be really important across health services, I believe, but definitely at UHD. And then the point about transport, really interested to work with colleagues in BCP, because over the next 18 months, as we do reconfigure services, we've got a wealth of data around the travel, the way our staff travel to and from and where across BCP. And actually working with some colleagues from within the local authority would really help us in terms of ensuring we land all the changes over the next 18 months to 2 years in a really good way for residents and for our staff. So really welcome that emphasis. Thank you.
Thanks, Siobhan. Any other queries or comments or responses at all? No, I think actually that I was worried there was going to be no discussion on this item, so I'm glad that actually the conversation got moving and we had some input. Obviously, I've seen this JSNA, and I'm pleased that people like Siobhan and David have actually, who looked at others in their roles. Actually, your sort of feedback that actually there's a lot of really good sort of data and insight in this is useful for those of us who don't spend our lives looking at JSNAs from around the country. And I think the next agenda item we're coming on to from the previous workshop about talking about strategy to action, that's, I suppose it's easy to say, but we need to make sure we've got all the right, good quality, up-to-date information and analysis and insight from that information to underpin both the strategic decisions and the actions that we're taking as a result of it. So it's not just a case of us noting that, oh yeah, we've got a JSNA and that can be put up, but actually I think, like Sam said, it's the important thing is that that's being used by the people that need to be aware of it, and is actually feeding into those the sort of strategies and strategic decisions that we're making. So so yeah, I'm pleased to see it. There's a lot of sort of useful insight and data within that. So if there's no other comments, then it's our role as a committee to note that we've got the updated joint strategic needs assessment document and approve publication of that document. So those of us on the committee, if you're happy to approve the publication of that document. Yeah, everybody's nodding. Nobody not happy to approve it. So thank you for that. We can move on to, and thanks Natasha for presenting that. So we can move on to agenda item 7, which follows on from the development session workshop that we had just prior to Christmas, from strategy to action. So if I could ask Sam just to present this item following on from that.
Thank you very much, Chair. So I'm pleased to be taking this report today. Although my name's on the report, it wasn't just written by me. It had some really helpful contributions from people in the Wellbeing Directorate and also from wider partnerships. And this paper is really summarising the output and the conversations that we had in the last development session, and we're proposing some recommendations about how we would move forward to develop a new health and wellbeing strategy, and then to start to think about how we continue to develop the role of the Health and Wellbeing Board and its governance and leadership of place-based working. So before we get to recommendations, I'll just perhaps talk a little bit more about the context. At the session in December, we had a bit of a refresher of what was the statutory role and purpose of health and wellbeing boards, recognising that they're supposed to be boards that lead locally on prevention and integration. We looked at the last health and wellbeing strategy, which was developed just as we were going into COVID, and noted some of the challenges with delivery under that strategy at the time. We looked at some of the other key partnership plans and strategies that were available that had been developed since that strategy, including the Integrated Care Strategy, the NHS Joint Forward Plan. And then we also had a look at the new BCP Council Corporate Strategy, really important platform to start to think differently about the role of the Health and Wellbeing Board and what could be delivered through the Health and Wellbeing Board that ties back to BCP Council's strategy. And finally, there was an opportunity to review some of the work that PricewaterhouseCoopers had facilitated on the development of the place-based partnership. So this was thinking about what would the partnership do, what functions would be useful to be delivered at a place level as opposed to Dorset, and really what would be the point of a partnership if it was going to develop a really strong vision about how health and care and wider services could really deliver on some of those important health and wellbeing priorities. Interestingly, from the discussions, what emerged was maybe a lack of love for going into another strategy review process. But actually, what was really positive was the energy in the room to say it's not really about the strategy, it's actually about how we enable the board to have a really clear focus on delivery. So we want to see something that's much more focused on identifying and understanding some of those actions that would be really important in the BCP Council place if we're going to make a difference in line with some of the other plans and strategies. So not wanting to add another strategy into a crowded space, making sure that the board is adding value and that we're not duplicating effort. I think the summary of those discussions was not to put a huge amount of focus onto writing another strategy, but the sense that those existing themes in the current strategy were good enough, those still broad enough, they pick up the role of the board around prevention, they pick up the challenge around how we're working better, transforming some of those health and care pathways. But what's really important is for the board to have a real clear steer on some of the place-based programmes that might be coming up through the emerging place-based partnership. So the second part of this paper is really about thinking, how does the Health and Wellbeing Board start to lead, and recognising that it does have a lead governance role. What might be some of the next steps that we need to think about as a Health and Wellbeing Board if we're going to be effectively leading for place? So the paper starts to propose some potential next steps, which are set out in paragraph 8. So next steps in refreshing the strategy. Paragraph 8 suggests a number of key programmes that we might want to consider should be visible to the Health and Wellbeing Board as it starts to develop that leadership role. There's an initial list that's been proposed here from officers. It'd be good to have some conversation on this here today. What we've suggested is that the development of family hubs for children and young people would be important, as well as other community assets. Rachel, you mentioned the development of the wellbeing hubs that are coming on stream. This concept of moving towards integrated neighbourhood teams seems to be picking up a head of steam. So Dorset Healthcare, primary care and wider partners, very interested in trying to get some pilots together to see how that new way of working will start to land. Really important to recognise that we've had a Poverty Truth Commission here in BCP Council, so some of the learning from that commission could provide really valuable insights into the culture and the way of working in those teams. Supporting adults to live well and independently. We've just heard about some of those key challenging metrics around hip fractures. What's that saying about our current system, and could we do that better if we had more of a prevention focus? But also some really important adult social care transformation coming through. The prevention strategy, the development of an integrated intermediate care strategy should all be picked up in terms of some of the important changes that the board should keep track of. We noted the transformation programme around community mental health services. Rachel, again, you've mentioned this new contract, which is starting to look at wellbeing. Are they called coordinators? Is that the word for them? Yeah, so really important to understand how that's changing the way that community mental health services are provided and whether we can support people at an earlier stage. Siobhan mentioned the importance of smoking, still one of the biggest risk factors that contributes to a lot of that variation that we see in terms of heart disease and stroke in our communities. And then finally, this sort of overlay of some of the challenges that we're seeing in all of our communities around cost of living, poverty and housing. So how do we make sure that that's still on the Health and Wellbeing Board's agenda and not just having a very narrow focus on health? So the next section suggests some next steps in how we develop place-based working. And I guess what I'd be looking for is a good level of discussion around these points. Do you agree that the Health and Wellbeing Board should continue to work on how it will add value as a board? That focus on governance, is it right that the board leads the place-based partnership? And recognise that I guess the potential opportunity to align with what Cabinet will be thinking about as we get into the delivery plan connected with the corporate strategy. And then for the board to continue to pay attention to the need for officers to come together and form an executive group under the Health and Wellbeing Board to start to push through on some of those programmes in the place-based partnership. And just some prompts there for today. What functions should we be looking at place level to support this work? Obviously, the importance of good data and intelligence we've just discussed through the JSNA item. How quickly could we agree an outline programme for the board to support in developing some clear deliverables? How do we make sure that we're continuing to get input from wider partners and stakeholders so that they can link in with some of the partnership work? And then how do we make sure that we get clearer reporting lines and accountability? And above all, not just talking about this, but what are the deliverables, by what stage would we expect to see action, and to avoid duplication, so that the work is talked about in lots of different meetings and lots of different places. This is really a chance for the board to start to try to line up the work in a way that there's a clear line of sight from the strategic group right to the top, all the way through the place-based partnership to some of the groups who'll actually be the doing. So that's my kind of setup to the discussion today. And I think I'll just bear in mind some of the challenges that with health and wellbeing boards is that they're not doing boards in and of themselves. They are strategic leadership boards, but that doesn't mean that they shouldn't be connected and challenging the executive groups and the delivery groups below them. So this is a real chance to try to get that alignment right in BCP Council. So just looking for support for the two recommendations. And just a reminder of those, that's to support the proposed approach, i.e. very light touch refresh of the strategy, not a huge effort to renew it, but having a clear focus on what might be the priorities for that place-based work plan. And then the second recommendation is to discuss and agree those next steps in how we get a really clear lead governance role for the Health and Wellbeing Board as the partnership develops. So happy to take questions, Chair.
Thanks very much for that background and that introduction, Sam. Yes, any questions or points? Kieran.
Thank you, Chair, and thank you, Sam, for that report. I was kind of keeping my powder dry on the last item because I didn't want to sound like break a record just to go on about housing all the time. But I think what I really liked about this report and the previous report is the links between them and how the needs assessment in the last report really drew out some of the issues we've got around housing, the affordability of it, the lack of it, the effects that it's having on people's health and their well-being, both physically and mentally. And so I really like the fact that we've put a bit of an emphasis on housing within it. I really like the kind of the nod as well to the Poverty Truth Commission. Obviously, the kind of the links that I myself have having previously been on that. I found it a really, really empowering experience for myself as well as those who are on it. So I think that's really good, especially as they go in. I think they're going to be going into a second iteration at some point, hopefully. So really keen on seeing that progress. One question I did want to ask was around the kind of avoiding duplication. So something we're doing in the community safety partnership is we just started doing a mapping exercise, kind of like getting all our thoughts together and really understanding what we have in terms of trying to solve these issues. So I was just wondering, is there anything that we currently have like that that we could potentially use? And if we don't, should we be looking at trying to kind of start to map what we have as partner organisations?
Sam.
Thank you. Thank you for your acknowledgement of the importance of housing and health. I think it's really important the Health and Wellbeing Board does keep its focus fairly broad, because obviously you can't separate out a lot of these issues. And also for the support to the BCC, I agree. I think it's a really important methodology. I think it's a really important way of working, and it does bring the voice of people with living experience closer to some of these conversations. I think this issue of a mapping exercise, I might think of it slightly differently. I think sometimes we're in transition as a system. There's a new system operating model, which obviously the ICB have been working on. What's really important from the place perspective is that partners and people involved in that work understand what's the main group holding the ring on some of this, because it's a challenge, I think, sometimes to understand where that's happening, and that's what I think this paper gives us the opportunity to do. in terms of the mapping that you're doing through the community safety partnership, what's that trying to do? Is it just mapping assets and people involved in work, or are you trying to get a better understanding of where the work happens? Because I think for me, sometimes we don't always get that right. It's not always clear, and that's why people feel there's this sense of duplication and confusion sometimes. But if we get this right, through this paper, hopefully the Health and Wellbeing Board can help to clear a bit of a way and say, you know, these are the 6 or 7 most important things, the most important programmes. We're not doing the work, but we're going to hold the ring on making sure that we're tracking progress. We're providing that challenge so that we know that things are moving on. And if they appear to be getting stuck, the board's a place where people can come and say, we're not making enough progress on this. What would need to happen? How would we unblock it? But interested to hear more about the CSP process.
Yeah, okay.
Yeah, so just to come back on that, it's trying to just kind of clearly get everything we currently have in terms of services. So yeah, basically service mapping kind of thing. So there isn't that kind of cross duplication, and that's between kind of all organisations. So not just within the council, but also our wider partners. So yeah, just to kind of avoid that duplication or anything. But then also that then raises the gaps, so we can see what we're missing and what areas we need to actually start providing a service or start to improve a service. So that's kind of the idea of it.
Rachel, you.
Thank you, Chair. In response to the mapping piece of work, I think it'd be really useful to connect around the Access to Community Support Services project that we're working in partnership with other organisations to deliver, which is one of those aspects will be a digital service finder, which is around from the voluntary sector perspective. Because one of the very challenging things, isn't it, is to map that vast array of services that exist from a voluntary and community sector, and we won't definitely do it all, but it's about trying to work with partners so that there is a space in which professionals can go to that can link them to what is available. So it'd be good to talk about that outside of the meeting, but I think it's important to note those mapping activities we're trying to hone in together to do a piece of work that is connecting to other directories on many systems, because lots of people have directories, but it's not about taking that directory and putting it into one. It's about those directories talking to each other using a system called Open Referral UK. So it's pulling in information from a source similar to hotelbooking.com, where they don't own any holidays, but they pull it in from other sources. And that's the concept of this piece of work. So I think it'd be really important to be aware of that, and we Kelly Hewitt is the project lead for that, and working with partners to connect that piece of work that we can catch up with, and that would be really useful just to cite people.
Okay, thanks for that, David.
Yeah, thank you. So where to begin? So many thoughts going around my head. First thing to say is I think this is great, right? So I know we've got to take a decision on the recommendations. But I think this is a fantastic development. This is such. It was a great session that we had in December. It really felt like we were engaged, we were in control of trying to determine what are the things we needed to pay attention to. And I know I was only in one of the groups, but the report reflects what we captured in our group, and I can see how it's put together with the other group. So I think it's a really, really helpful, and let's not underestimate how important this is as a step forward towards enabling the Health and Wellbeing Board to do exactly what you said, Sam. It doesn't normally get able to have a chance to do, which is actually pull some levers to make change happen in this collective space. So I think it's really important we get behind this and work to try and make this happen, so that the Health and Wellbeing Board holds just the strategic space and holds the place-based partnership to account, where the executive will come together and basically enact the work that the Health and Wellbeing Board wants to see come through. So I'm totally behind it, it feels like I was thinking this is one of those kind of bureaucratic things you have to do and go through, and so where's the energy? So I'm going to give some energy to it. I think it's brilliant, and I'm really excited about what it can offer us and enable us to do over the next few years. So the only thing I would ask then is I was just checking ahead to the next Health and Wellbeing Board meeting, which is not until April. And just maybe outside of this, but just the ask around how we sort of put this together. So when we come back in April, we're looking at something a little bit chunkier, so that, you know, we've got, maybe we hear from the place, I don't know how fast that will mature before April, but, you know, something like that, the partnership coming to us and saying, this is the work we've done, this is what we think we should be focused on, this is how we think we should run, and give us a chance to sort of then say, yeah, that's all the right stuff, maybe not, and then off you go. And then we'll track, we can then plan the agenda for the rest of the year in terms of what we expect to see here in terms of progress, or, you know, escalation of issues, which we can help with. But you can't do any of that unless you've done this, and that's why I think it's really exciting. Thank you.
Thanks for that comment. Actually, that's really useful. Yeah, Patricia.
Again, what he said, I think that it's absolutely true. You know, we've got to a great place. I was just also reflecting that not everything is going to be done by us. This feels like we're doing unto, and actually the communications part of this is going to be equally important, talking to citizens and people and our voluntary sector and businesses and others to remind them of their role in this piece of work as well, setting out where we're trying to go, the outcomes, what we're expecting the results to be, and why it's so important, getting that message out as a big part of this program as well. So it's not, this isn't all for us to do or for anyone to be doing unto others. It's trying to enable people to make choices in the right direction.
I'll Siobhan online first and then pick up others.
Just to fully support the recommendations in the paper, and also on the previous two speakers, I totally support what they've said. I suppose from my perspective, I'm just sort of thinking, so what are the real tangible next steps? So who does what and when, and how do we get some traction? Because so much is already going on, isn't it, at place? So actually, how do we really move forward with some real tangible next steps? So we're all cited on it. So when we do come back in April, we've actually got quite a lot of detail about the baseline, about what we're doing, about who's involved and who is part of this, but really support the health and wellbeing role in this and the lead governance role in relation to it.
Thanks. That's Siobhan. I'll ask Gillian next.
Thank you, Chair. And I can make my point, which in part responds to Siobhan's point and question, I think, as well. I'm really delighted that the paper's had such a positive welcome, and we did want to bring the paper back quickly on the back of the development session last year because there was such a positive energy around it. Place-based partnerships, first of all. I think there's a real risk around some of these governance issues that you can get quite circular around them. What's a place-based partnership? Exactly how does it work? Who's on it? And so on. But the approach we're proposing in here, which I think we've got endorsement for, it sounds like, allows us to say, well, form should follow function. And if these are the priorities and these are the things that we want to achieve, then we can put the building blocks in place with partners to achieve them. And I think that's the task of the next 6 weeks or so, looking ahead to April. I think the kind of challenge that David brought of looking ahead to April and saying, where will we be? We want something more tangible then. Exactly shows the benefit of the Health and Wellbeing Board stepping into this space, because you should be holding us collectively to account for seeing some tangible progress. And so please, more of that, and that should continue. I wanted also to make a specific point about one of the priority programmes that we've proposed on here, which is integrated neighbourhood teams. Sam mentioned that that's something that's starting to gather a bit of a head of steam and gather some energy. I think that's absolutely right, and it's really, really important. So what we've already put in place since we put the paper together is a bit of a working group that's coming together across ICB colleagues, with Dorset Healthcare and with Dorset Council to start looking at this idea of pilots. We've already set ourselves an increased ambition. The paper talks about 1 pilot area. We're now suggesting that we should have 2 in the BCP council area, and we want to come to you outside of the Health and Wellbeing Board to start to have conversation about what's the right place and the right space to start the next pilot. I think that project in particular is one that can has the potential to make a really, really big difference, and we will need to work with to connect up with lots of the other programmes that are here, family hubs, wellbeing hubs we've heard about. There will be other initiatives too, and we'll need to stay really joined up and connected with partners. So I did want to just have a bit of a flag for that project in particular. But I think on all of these, by April, we should be coming back to you with a much fuller set of plans and ambitions, so that we can move into that mode of driving delivery and holding to account.
Thanks very much for that, Gillian. That's really useful. Rachel, did you want to come in?
Chair. Not sure whether I'm saying something that's already been articulated, so I'm being very important asking. From a voluntary and community sector perspective and that lead, looking at the next steps, whilst partners would be assuming that we're part of that, wondering from that system approach where PCS are a key partner in that overarching space. I just wondered, it isn't articulated particularly in that paragraph, but I'm just putting that forward. And in terms of integrated neighbourhood teams as well, it's so key that those conversations are going on alongside, because we are in those conversations with various programmes along the way, and that's really great, and we're fully embedded. But it's having that recognition of that partnership viewpoint from the outset, and I'm sure it really is. So I'm just saying, I don't know whether that's articulated as clearly as it could. Thank you.
Thanks for that comment. Any other points that I think had some useful input there, David, Gillian? Yeah, to talk about where we're going, what will be coming up in April. Sam, if you wanted to sort of.
Yeah, thanks for the comments. Really helpful to kind of hear how this paper's landed and sort of what it means to people on the board. Just to kind of check back in by the next Health and Wellbeing Board, by April, if we presented a sort of draft strategy with a delivery plan for the place-based partnership to be consulted on, is that a concrete next step? Because you have to consult, you have to engage around the strategy. We're saying less on the strategy, more on the plan. Does that April milestone give us a chance to then take that to the board with a bit more flesh on the bones? And I note the points about perhaps being a bit more explicit. How do partnerships and partner organisations get engaged? I do take Gillian's point though. Sometimes this will be about form following the function. So as it's clearer who's holding the ring on some of these work programmes, then that should fall out of the delivery plan, hopefully.
Just a comment there on consultation. So yeah, just for myself and maybe others to just understand a bit more about the consultation on our sort of strategy and plans. That need public consultation period, or is it very much sort of partner consultation?
I'd have to double check, but from memory, I think it does need to be public consultation. But perhaps we can take that back as an action from the board. So we'll clarify that.
Okay. Yeah, thanks for that. Any other responses or comments or that? It seems surprisingly positive, actually. So I think you've done put together some useful points there then, Sam. If everybody's, yeah, there's obviously not anybody disagreeing, and I'm not surprised. I think, having been at the session in December, I'm not an expert, but yeah, it seemed like we had exactly the right conversations and points going on there to sort of thrash through. And I think it's interesting the point you made, Sam, that we're not a sort of action body as the Health and Wellbeing Board, but we need to sort of make sure that the actions that we want to see are taking place and get report backs. So I'm anticipating then over the months, as we have our sort of forward plan and our meeting, we'll be having over the next year or two regular report backs of this is where we are with this programme, and I don't know, key performance indicator type of things, red, amber, green indicators about well, this is how we're progressing. This is and potentially, budget asks and that sort of thing. So I think you're right, it's the right sort of timing, because now BCP have sort of got the vision and strategy together. And then this month we'll have the sort of budgets clarified, which is inevitably, always an influence on sort of what actions that we can push ahead with. So once budgets are clear for ourselves within the council and across the sort of wider partners, then it's the right time for us to be sort of detailing those actions. So the recommendations on this are for board members to support the proposed approach to the strategy, so i.e. the light touch refresh with a clear focus on priorities for the place-based partnership work plan. And I think from what I've heard, there seems to be sort of unanimous support for that approach, as well as obviously discussing and agreeing the next steps and developing the board's lead governance role in relation to the place-based partnership. So agreeing the next steps is, I suppose, particularly is that sort of short next step for the April meeting. Do we want to particularly specify what our sort of what next steps are? We've sort of had a discussion, but agree particularly that we have a paper in April with the more detailed plans and actions and draft strategy and draft plans in preparation for consultation, of whatever form consultation that needs to go through. Then at least we can make sure it's sort of pushing on any. So we've been in agreement with that. I want to see any other sort of more detailed sort of actions that we agree. Right, enough. Nodding heads. So right, unless there's any other sort of specific actions or any other sort of next steps that people want to see, then it's really that what we have coming to our next April meeting. So yeah, everybody's nodding their heads on taking it then that those recommendations on our following on from our workshop before Christmas are all okay. Good. Thank you for that. Yeah, and I think it's I think David made a good point about the sort of action in the room. It's quite difficult some of these meetings in the the energy in the room, isn't it? To have, but I think actually I think just the acceptance that we're all sort of going in the same direction. I think particularly the point about duplication for me was not about partners duplicating things, but actually if we're both pushing in that direction, we're doing it together. So therefore actually we're not duplicating, but we're actually sort of doubling up on what we can actually deliver in areas rather than each just doing the same. So thank you for that. Right, there's no other comments, then we'll go on to just our final agenda item 8, which is on the forward plan. Just call it up. Right. So agenda item 8, forward plan for our Health and Wellbeing Board. It details the 2 items we've had for today's meeting. Then the 22nd of April is our next meeting. So we've got a good couple of months to sort of get things prepared for that. I think we'll obviously add what we've just discussed about the next step on our strategy to action, about sort of more detailed plans and actions and draft strategy for that next meeting. Got drafted there as eliminating food insecurity access to food partnership presentation there, and the Dorset Healthcare update to the board on the joint management structure with Dorset County and how this works with BCP residents. So those, I don't know, I'm just looking around to those people that are involved in those to see whether they're sort of all still in plan and in place, and that we expect to have those there. And I think with what we've discussed today is that there's the additional item coming, and that looks like a fairly a manageable agenda for that. So, Gillian, did you want to?
Yes, just to say on both of those items, we are expecting those to be ready. I think we do, in addition, need to bring the strategy back so that we're keeping up momentum around that. I think the other issue that I would want us to touch on as a board is the integrated neighbourhood pilots, which we can either do under that strategy update or even in connection with the Dorset Healthcare item, because they're important partners, along with many other partners in that specific piece of work. So I think that would make a really good chunky agenda for April, if everyone's agreed.
Okay, That sounds good. Whether we have it within another paper or on its own, that sounds like a useful suggestion about the integrated teams. Okay. Sam, did you want to?
Yeah, just one other item on the forward plan. We've still got the place-to-place partnership report from PwC down there. I'm just wondering whether we've moved past that now because we've considered it in the development session. It feels like we've got a different energy around just getting on with it. So we could take that off in my recommendation.
Yeah, I mean, I think David, you've got your name against that one.
Substantive role, yeah.
Yeah. Yeah. So is that are we content that that's been sort of the outcomes from that work, place-based partnership work that has been integrated with what we've done?
Big part of the next report.
Okay. Okay, good. Yeah, I'm just looking forward on those other future items that have been discussed about changes to hospitals. I guess that's going to be very much around the sort of timing about how things are progressing with the hospital changes and the right timing for that.
Chair, just to agree, yes, just to agree with you. I think it would be really helpful to have it on the agenda. And if you think about the maternity changes, we need to be really clear with our communications and public around changes to maternity services at least 9 months before they happen, which actually brings us to about June. Which brings us to June. So actually, that actually would be quite good timing if there is a meeting. We'll be communicating in lots of ways, but bringing an update to the Health and Wellbeing Board would be very helpful.
Okay, so that sounds not for the April meeting, but for the meeting after that, then that we'll sort of pencil that one in. Okay, thanks for that. So I'm never going to know all of these things, but obviously you're aware of this 9-month issue around maternities. Thank you for that input. The other items we've got down there, it's got about BCP local plan, which is out to, well, I think it's from March. I think it's going out to its sort of public consultation. So I guess then we'll look at some timing around how that sort of feeds in the future as well. And others, I guess, I think there's other. Yeah, I think there's other items there where to sort of catch up with other officers. But it sounds like we've probably got enough for April anyway, with those sort of those couple of items that are listed there, plus the progress on our strategy and adding in about integrated teams. So, okay, thank you for that. I'm conscious we've only taken an hour, but maybe that means we've got another hour to work on our draft strategies and actions and things that kept in our diary. So yeah, thank you all for coming along. It's actually really useful to have the conversation. Sometimes, I suppose these committee meetings, if you have actually sort of more robust arguments and disagreements and contested votes, then you think, oh, that's more enjoyable meeting in some ways. But actually, it's nice to know that everybody's really going in the same direction and keeping informed and actually supporting what each other are doing. So thank you very much. And on that note, I think we shall close the meeting.